Welcome back to the thebolusmaximus podcast. My name is Matthew Taro. I'm here with my co-founder, my co-host, Mr. Brandon A. Denson.
Thank you. Thank you for having me.
What's up having you? Like, you just showed up in my apartment, bro. Typically, Brandon and myself are joined by a guest. Today, it'll just be the two of us having a conversation about a topic Bolus Maximus feels needs a little bit more attention. Speaking of attention, today's conversation is about erectile dysfunction and the link between diabetes and men suffering from ED. So, without further ado, today's guest and specialist about erections is here with me today, Mr. Denson. Sorry.
Well, hello.
Sorry. This is an adult conversation. It is something that we are excited to talk about. I jokingly have called Mr. Denson a resident specialist. This is a personal talk, right? This is two guys really just talking about something that's really important. So we want to make it very clear that we are not trained medical professionals. Disclaimer, disclaimer, disclaimer.
Disclaimer.
Yeah, so anything you hear on this podcast is just two guys talking about their experience. We're going to go ahead and open this up. I just want to say that a normal erection requires a neurological response to increase arterial blood flow, smooth muscle relaxation to allow for the increase in blood flow, and restriction of venous outflow to maintain the erection. So basically, there are a couple components here that are needed, and if diabetes is not well controlled, it may be the root cause of irreversible damage to the nerves, the blood vessels, and the smooth muscle function, which are necessary for erections to occur. So don't want to scare anybody. I just want to throw it out there, make sure that you understand what it is that we're talking about. This is coming from the Boston Scientific Corporation. They've got some information that we can link here below us, specifically about erectile dysfunction. So, we had a call today.
I think it was a really good call. It was a much needed call. Even though we also had females on the line as well. But getting their feedback, and obviously one of them is a CDCES. So obviously we had somebody from a medical standpoint that could elaborate on a few other things, even though she says she's not, a sex therapist or anything like that. But at the end of the day, I think hearing from individuals within the community, male or female, kind of helps us kind of have further these discussions that we've been having, because they are, they're not the easiest things to talk about as we look at, some people may not feel comfortable sharing that with other people, but most importantly, people may not feel comfortable sharing that with their licensed medical professional, whether that's their primary care physician, endocrinologist, so on and so forth. So I think the conversations that we had today was good, and it's a start to kind of open up that door to let people know it's okay. Like, we know that diabetes comes with many different complications. This is a huge complication.
Yeah.
But I think being able to have a space to talk about those things and feel comfortable, I think that's what we're about. We're about, creating that safe space to allow other individuals to talk about the tough things.
Yeah, and dude, real talk, I had no idea before Anna told us today that the conversation really doesn't come up on the other side of the fence, right? So from the perspective of patients, we want to throw the other side of the fence as the clinicians, right? They're the ones who are helping drive our care for diabetes and personal care. She said basically that there isn't much discussion revolving around this topic in general. So the fact that it's coming up, it's come up a couple times in some podcasts and in conversations that Brandon and I have had in the last 6 months to a year. It's something that, as it's been coming up, we've decided we need to talk about it. So this is officially kicking off what I would say is the beginning of a mini series dedicated specifically to this topic. Not to ostracize the women or anybody who doesn't identify as a male, but it is a very male-specific issue, something that ages 20 plus 1 in 5 men suffer from some degree of erectile dysfunction. We'll get into that. And of men with diabetes, more than 50% have erectile dysfunction caused by their diabetes, which means 1 in 2 men you see could be suffering from ED. Now, that's a pretty big statistic.
It's large.
So
it's large.
What I'm going to say is that with a grain of salt, again, this is coming from the Boston Scientific Corporation. This website is linking you information, ways to find help, some tips and information about what to do if you find yourself in a situation like this. It can occur in men with diabetes 10 to 15 years sooner than men without diabetes. And it is 3 times more common and more severe in men with diabetes compared to men without. So our conversation today, one of the topics that came up was basically how us both being males, knowing that having a penis ultimately at some point helped, in my mind, define me as a man. And whether or not it worked was evidence of how much of a man I was.
Yeah, because as a man, I guess if you take that away, then you don't really feel like a man. You're still a man, you still, but I think the identification of having that working part down below gives you, I guess, that extra that you are a man.
Can you not do sound effects? I'm just kidding. So yeah, that because it's not frequently talked about in such an open setting, like you and I are trying to create here. You're like, oh, is that real? Like, are you guys really talking about? Like, yeah, it's what this is probably one of the most serious and significant conversations to have. Because one of the other topics that came up today is mental health. So if the issue is that the blood flow is not properly happening because nerves and arteries have been damaged because of the lack of care of diabetes, which means you can't get or hold an erection, which means you can't be sexually active or happy, what does that do for your mental health? As somebody, not to out myself, but whether or not you're sexually active or not doesn't matter. But I can tell you how much happier I am as an individual when I am versus when I'm not. And by yourself doesn't count. So realistically, I guess technically it does.
It does.
Because in this situation, if you can get and hold an erection, it doesn't just mean that. Right, and then this is where we want to bring in an expert. Again, not medical professionals. We are not trained medical professionals. Disclaimer, disclaimer, disclaimer.
Disclaimer.
We are trying to open this conversation so that we can hear from medical professionals a little bit more about this topic. And then the specifics. Like, what would you be, like, number one question when it comes to ED for either, not necessarily just like a sex therapist, but somebody who might specialize in male complications from diabetes, which this would be one, if not the largest. What would your question be? Like, do you have a question in mind? Is there something that you've thought about now that we've been having these conversations from today even?
I mean, I guess not from necessarily from a personal perspective, but I want to know, like, why is this not talked about coming from the endocrinologist or the primary care physician? Because we already know what the statistics show. So like, is this I would want to know, is this a commonly asked question amongst people that live with diabetes, and not just type 1, type 2 as well. Is this a issue that somebody may have with their patient? and obviously with HIPAA, you can't talk about names and all that. But, I think on a general level, is this a conversation that doctors and endocrinologists are having, with their patients? Are their patients having trouble getting an erection, and, do the patients feel comfortable talking about that with them as licensed medical professionals? I think that's a big, that would probably be like my questions that I would ask.
Yeah. Yeah, I think it's great for us to think about this now on this, very intimate, like just a couple people talking about it, and then really trying to open the conversation. And I think to get the conversation started, right, so there's going to be two directions that we head as Bolus Maximus, myself and Brandon here, our teammate Anna Barish, CDCES. We're going to head in a couple different directions here. One is like going to the community and fielding some kind of survey and getting some information. The other side of it is to go to clinical route and to go back into those rooms where those CDCESs and those endocrinologists are having conversations and building plans out for their patients, and not to be crude or inappropriate here, and basically putting boners in their face. Basically saying, why isn't this conversation more important? But even more so, like, why isn't it happening? Like, why doesn't it happen? And then you get to like the important level, like the importance of it.
Correct.
I'm gonna kick it off. Like we're gonna keep it brief here, and our time is short. We've only got a couple more minutes, but in an effort to open this conversation, I'm gonna personally share something here. This is not something that my teammate here told me I had to do, or even knew I was gonna do. I did share it today on the call, but I think it's important, if anyone's listening, you understand where I'm coming from, hear something like this from your partner. Just want to make sure that you understand, like, this is the type of stuff that may potentially come up. And if you do hear or see something like this, my understanding after the conversation that I've had today and this last couple of weeks is like, technically, just this is something I may want to consider having a conversation about. And so what I shared was that while active sexually with a partner, if my blood sugar is significantly higher, it is more difficult for me to maintain an erection. So ultimately, in simple terms, I finish faster when my blood sugar is really high. And it's actually something that I had a conversation with my partner, my last two partners about. It was something that I was aware of, but it really wasn't something that I had considered ED. So even now, like this is me opening up and being vulnerable and saying this, but it's also me kind of asking this question, like, oh, where do I fall? It's something I'm going to speak with a medical professional about, right? First and foremost, go to the doctors, go to the professionals. But then it's something I want to open up with the conversation here in the community. Where are you coming from? Is it your partner? Is it you? Have you ever had an issue like this? Is this something you've experienced? I would really like to hear some feedback. If you do have questions, please let us know. That way we can appropriately ask when we do have the professionals in front of us.
Proud of you, man, for sharing that.
Yeah, hey, thanks.
That's a lot of people won't even open up to their doctors, but you're sharing this information to the world. But at the end of the day, I look at it as these questions that you may have or these things that you go through, you're not the only person going through them, right? And I think that's another thing. Why we do what we do at Bolus Maximus, because we understand that the things that we go through as subject matter experts is going to be important to other individuals that are out there living with this disease. And, if we can help out in any way, any shape or form, that's what we're going to try to do. Nobody, we want to say that we all have secrets and this and that, or we feel like this only happens to us, whether it's from a mental health standpoint, whether it's from erectile dysfunctional standpoint. We all hit these roadblocks and we go through things, but, we have to continue to communicate and be vulnerable about what we're doing so we can help others along that path as we continue to build these things out through Bolus Maximus. So thanks for sharing that, Matt. Appreciate that.
Yeah. Hey, it's lead by example. And I think as we develop this organization and others get involved in what it is that Brandon and I are doing, we want you to feel confident to go out and then share. I'm not saying this, like, this is, I've been sharing parts of my life for years. Like, this is relatively new for me to share, but it's also something I'm not really embarrassed about. Again, not everybody deals with this. And even though I have had issues, as I just described, the rest of the time, I'm a pretty confident individual. So for me, I want to strike the conversation so people feel confident. It's happening here. The more we have it, the more comfortable we should feel about speaking to strangers. May it be your medical professionals, as Brandon mentioned, or maybe it's a group of individuals that you just met, and it's all young men. You say, hey, I just want to let you know, just like people would tell us about our eyes.
No different. It's no different.
No different.
No different.
So let's get the conversation going. Have it with us. Have it with your friends, your family, your partner. If anybody has questions, send them to us. Let's get them in front of the professionals. Let's talk about it. If you want to anonymously share a story or a situation that you have found yourself in, please do. It would be very helpful. Again, our teammate, Anna Barish, is going to be looking for some stories and a bit more information as we dig into this. This topic is not going away. It is something we will continue to talk about. We're going to try to lighten the mood. But at the end of the day, it's a serious conversation for both physical and mental health. So if you are a male or somebody who identifies as a male and you have the ability to achieve erection, and at any point you felt like it was dysfunctional, these conversations are for you. And if you've never been in that situation, just listen up. You may learn something, and you may hear something or have a conversation with a friend who might need help. So,
and then we'll link that article as well.
Yeah, and we're gonna link some information here at the bottom with these graphics so that you can take a look. They're pie charts, not graphics like you think I'm talking about. Yeah, and then we'll be following up pretty soon. So, Brandon, was there anything else you wanted to share today?
No, man, that's it. I think this was a great, as we quote unquote call it, the after party meetup. After our call, and this was good. This was good. I think kind of spilling over from the call today, and then kind of spilling over into what we're recording as far as the podcast. I think this is another layer to what we're doing. It may not be the easiest to come on and talk about some of these things. You may not even want to. You may not, want to be vulnerable, but this is how we continue to push things forward within the community and talk about the tough issues. We're talking about tough stuff that doesn't get talked about every day. And I think if we continue to change the narrative of what that looks like, talking about the tough stuff, in a minute it won't even be tough because people will feel very comfortable and won't make them feel vulnerable about talking about it. It becomes second nature. So no, that's it, man.
All right.
Well,
this is Brandon A. Denson, and I do that all the time. I say your names.
Yeah, I don't know what's up with that, man.
It comes first. This is Matt Taro.
And I'm Brandon A. Denson.
And we are currently the two members of thebolusmaximus that you will see in front of the camera. Hopefully we get some other faces here soon. Thanks so much for joining us. Check out the rest of our podcasts in the link below. If you have any questions about the equipment we used here today, we can also answer that. There'll be some links down there. We'll see you next time. Keep it 100.
Keep it 100.
20 minutes.